I have a small consulting firm that specializes in health economics and epidemiology. I'm also an adjunct professor at the UBC School of Population and Public Health. What we try to do really is to take the fields of economics and epidemiology and tie them together and help people who understand the economic areas and the clinical areas to communicate better. And so when we do economic work, we try to make sure that clinicians and others in the field have a good sense of what it is we're talking about. So that makes making sure things are clear. At the same time, we try to take the clinical aspects of work, so that's where the epidemiology piece comes in. And again, try to take that to a level where people who are, funders and others can understand it. It's really tying those things together is what we have sort of spent our work life doing. And so that means working everything from sort of on the academic side of things, working with fundraisers, with governments, etc. And in this case, working with organizations such as RHI. I got a phone call from Bill Barrable. And so when he became the CEO of the Rick Hansen Institute, he called me up after a couple of months and said, Hans, I'm getting all this unusual sort of range of what it costs in terms of caring for a person with spinal cord injury. $1 million, $10 million, just do a quick review of the literature for me and tell me what the consensus is. And I did that for him. And the problem was that the literature is not very clear on this either. And there's lots of research done. It's not a lot. There's limited research done, much of it from the States, where the costs are different than in Canada, etc. So it started off with a phone call just saying, can you answer a fairly simple question for me? And it wasn't that easy to do from the literature. And so then we started modeling, taking whatever information we could from the literature and modeling it and putting it into a sort of an economic model that said if we took the best information possible, what would the lifetime economic burden be, both for a patient with paraplegia and tetraplegia. And then we took that another step further and found additional information that said, well, we could look at that also by complete and incomplete. And one of the things, of course, I'm learning here is that every patient is unique, which is true. So every time you come up with some averages, no matter how finely you slice it, they're probably not terrific because every patient is unique. But we were able to do that based on the fairly limited data that was available in the literature and doing some modeling. And so that's actually what we presented at the conference for the first time, the economic burden of spinal cord injury in Canada. And there's an interest in that, I think, because of a variety of reasons. One is it's just not available so far. And people and funders and researchers and physicians too want to know what the economic impact is of things that they're doing. And we also looked at not just the direct health care costs, but indirect costs associated with the morbidity that's associated with spinal cord, the very severe morbidity in many cases, and the premature mortality. People with spinal cord injury die on average 15 to 30 years sooner than somebody else, based on the time when their injury happened. So they lose part of their life as a result of that, even if they survive the initial trauma. So there's quite a bit of interest. And for funders, governments, and others, they're always interested in knowing not only what the costs are, but if we can improve patient care, if we can reduce complications, if we can, what is the potential for cost avoidance or cost savings as well in those areas. So our initial research said just, what is the economic burden for both for the individual and then in Canada as a whole. And so we've got that with this model that is based on sort of limited available data. The next piece was to try to look at components of that in terms of complications, and some of the bigger complications are pressure ulcers and urinary tract infection. And again, the data is limited and the data is weak, and so we're modeling, but we're modeling on a basis of sort of incomplete data and making quite a few assumptions. So that takes us to sort of the next phase of the research that we're hoping to do with RHI, and we've actually already started to initiate this, getting actual data, Canadian data, here in BC based on variety of data sources that are available here, and compiling that, and trying to see then, if the modeling results are similar to actual results. And again, there will be complications with that, but it'll get us one step closer to sort of fine-tuning and coming closer to these results. It'll also allow us to see this large variability in terms of, both the individual patients are very individuals, right? And so their economic burden will be very individual as well. Somebody asked me the other day, what's the range, right? I have these costs. It costs $1.5 million a year for an incomplete paraplegia, up to about $3 million on average for somebody with complete tetraplegia. But it could be much higher than that. It could be 10 million or 15 million or 20 million, depending if you're on a respirator and right now we don't have that information, that individual level information. So that would be the next thing. There's still very much a need for this kind of information. There's quite an interest, I think, too. After I presented, the poster, there's people from a variety of different countries that came up and said, we kind of need this information. When is this coming out? So there's a need and a desire for that.